And so it was really nice to see that they're
Yeah.
thinking about that, you know?
You think Western doctors who got 12 minutes could use a different dynamic yeah.
Well, I mentioned to her that it's the same issue because, you know, this was the same conversation we were having earlier on the weekend, was that the dynamic in Ayurveda also changed, and we were following the allopathic paradigm, and now we have to also shift back to the original paradigm.
Right.
Okay. So, you know,
Okay.
it was really it was very nice to be able to see this sort of open response to the the younger generation of medical students compared to, you know, what we typically are used to. So it was nice. It was nice. Okay, so now that we have a few of our participants, we can get started. Okay, so you want to mute your microphones and your videos, and then we can get started. There we go. Okay. Okay, so welcome back, everyone. So lovely to see you. Today we are going to discuss the topic of fibromyalgia. And I know we slightly touched upon it over the weekend, but I kind of wanted to go over it in a little bit more detail. And even though the treatment is basically the same thing that you have in your notes, I wanted to give you some practical examples and look at the nuances of this condition, because again, this is also something that's very, very common, and you probably have already seen cases of fibromyalgia, or if not, you're probably going to see cases in the future. So just so that you have a fairly clear idea about what the approach is. And the thing about this condition is there isn't a direct translation in Ayurveda, and there isn't a lot of literature out there either, because I think fibromyalgia as a condition or as a diagnosis hasn't completely reached the Ayurvedic community in India yet. So they haven't started deciphering of how to correlate this with what we know in the classical text or what we typically look at. And so I've kind of done a little bit of background research and also looked at some of the things that is available online and tried to piece it together in the easiest way that you guys can understand, and that does have a relation to what we know or what's kind of mentioned in the classical text. Okay, so we're just gonna go over that today. And also I do have two cases. We're going to try to get through both of them, if not at least one of them that's fairly apparent and is a nice example of this condition from the Ayurvedic perspective. Okay? Okay, so before we get started, let's start with the prayer. Yo Vishwam Vidadhati Pati Satatam Samharayatyanjasa Srishtva Devya Mahausjadischa Vivida Duri Karotyamayan Viprano Jalana Chakasti Bhuvane Piyushapurnam Ghatam Tam Tanvantari Rupameshamamalam Vandamahe Shreyase Vandamahe Shreyase Vandamahe Shreyase. Om Shanti Shanti Shanti. Okay, so I am just going to share the PowerPoint. Hopefully you all should have gotten it. I just sent it to you just a few minutes ago. But so the PowerPoint basically has most of the information that's available from the conventional aspect of what we know or what is understood about fibromyalgia. So I want to kind of describe that a bit first, and then we're going to look at how we could possibly correlate or understand this condition from an Ayurvedic perspective. Okay? Okay. Okay, so fibromyalgia is a condition that's defined or understood as it's a neuromuscular disorder characterized by widespread pain. Fibromyalgia also tends to present with any of the following symptoms, such as fatigue, cognitive difficulties, and variance in mood. Also, there can be sleep issues, memory loss, can present with chronic headaches, and that also includes migraines. There may be numbness and tingling sensation, and sometimes this occurs, all of these conditions or all of these symptoms occurs in one person, and sometimes it can be just a few or one or two. Okay, it all depends on the severity. And also there may be some swelling as well. Certain associated symptoms that we do tend to find either at the onset of fibromyalgia or later in the progression of fibromyalgia. The person may also develop tension headaches, temporomandibular joint disorders, irritable bowel syndrome, anxiety, and depression. So as we look through these symptoms now, and the reason why you're going to notice that what we're going to talk about today seems a bit repetitive, but for the purpose of repetition, actually, I wanted to put this in there to show you how it all starts to tie together. And also for you to become familiar in looking at the symptoms that we've been talking about and that we've been going through. Because if you notice, again, it's always the same sort of symptoms that keep popping up. So as complex as the condition may seem, or as complex as the pathology may seem, it actually still always goes back to the doshas, and it still goes back to all the fundamental things that we know. So I just want you to keep that in mind as we're going through this, and see if you start to develop a thought or an idea as to what you think it is. Now, I know we already discussed and I kind of gave it away before, but I want to see if you're developing the same sort of ideas as we're reading these terms, and see if it's starting to click those check boxes that we were talking about. Okay, so just try to keep in mind and see what sort of follow your thought process as we're going through this. And I want to get everybody's opinion of what you think or how you think it's been, it formulates and it starts to develop, and it starts to then create this pathogenesis and this pathway and then presentation. Okay, so this is just a diagram that indicates what conventional medicine or researchers think that fibromyalgia may be. Okay, and in that, what it's indicating, they say that they're not exactly sure why this condition happens or why it starts to occur, but they believe it may have something to do with nerve stimulation. It's repeated nerve stimulation that causes the brains of people with fibromyalgia to change. This change involves an abnormal increase in the levels of certain chemicals in the brain that signal pain, such as neurotransmitters. In addition, the brain's pain receptors seem to develop a sort of memory of the pain and becomes more sensitive, meaning that they can overreact to pain signals. So I put this in here because I wanted you to also look at where exactly in the brain we are perceiving pain, one of the major areas that is responsible for the perception of pain. So pain can be perceived actually in multiple areas of the nervous conduction, from when the nerves are actually stimulated to the point where it travels to the brain and we perceive that that stimulation as pain. So it can start the stimulation from the brainstem. You can also perceive it in the thalamus, but the main area where it is understood as pain, or the cognition of it being pain, is in the cerebral cortex, and specifically in the somatosensory cortex right here. Now, one thing I want you to, why I put this in here is because I also want you to look at what are the surrounding other functions very adjacent to this area. So here you also have the motor cortex, generates signals responsible for voluntary movements. Okay, another little thing to keep in mind. Also, what you have here, right underneath this area, you have the primary auditory cortex, which detects discrete sound, quality of sound such as pitch and volume. That's right here. You also have the Broca's area, which is a little bit lower than that, which is vital for formation of speech. You also have another area here, the Wernicke's area, which interprets spoken and written language. That's right next to it as well. And you also have the auditory association cortex, which analyzes data about sound so that we can recognize words or melodies. So here also, if we're looking at it from a conventional aspect, even in this perspective as well, this should be ringing some bells in your mind. I'm not going to tell you yet, but hopefully you already know the answer. Okay, so in looking at even where in the brain, where this disease may be originating from, or this condition may be originating from, where there is hyperperception of pain, or there is a memory of pain, and whatever that overstimulation of nerves, that instead of it being understood as regular stimulation, it is instead misunderstood as hyperstimulation or painful, is understood in this particular area. Okay, so I just wanted to put that out there for you. So some of the major causes, and the exact cause isn't 100% determined yet, but what they've described as what may be causes for this condition, they say that symptoms tend to appear or manifest typically after any one of these conditions, such as physical trauma, or even surgery, or certain infections, or significant psychological stress. These are certain sort of major prerequisites before you find an issue or a manifestation of fibromyalgia. In other cases, certain symptoms may gradually accumulate over time with no single trigger event. That's also something to keep in mind. Okay? Next is the pathogenesis. The pathogenesis, as described by conventional medicine, is that the disease process, for fibromyalgia, is uncertain. Certain factors that are considered as possible contributing factors are oxidative stress or genetic predisposition. They think that there may be a correlation between people who have this in their family, and it may have a genetic expression that does tend to translate on into other generations. So for instance, if a person's mother or father had similar sort of conditions, then there's a possibility that they may also develop fibromyalgia. Okay, viral infections, that's also another possibility. Hormone or neurotransmitter imbalance, so the reduction in serotonin and endorphin levels, that also has been indicated as a possible causative factor, or one of the major things that occurs, and then there is appearance or pathogenesis of fibromyalgia. Elevated cytokines, neuroimmune mediators that tend to be excessive. So there is hyper stimulation of the nerves, immune dysfunction, and psychological or psychosocial factors as well. Okay. The diagnosis for fibromyalgia, how it's typically diagnosed, or how does somebody understand that they do have fibromyalgia? There are a couple of things that the person does go through in order to be diagnosed with this condition. First, they look for the patient history. So the cardinal symptom of this condition is widespread pain, and that pain should be present for more than 3 months. That's sort of a basic criteria in order for it to be fibromyalgia. For instance, if you have widespread pain, but it's on and off and it's not really, it hasn't been around for such a long time, then it may not necessarily be this. It could be one of the other factors. Also fatigue, they tend to have fatigue, but it's again more constant or can be throughout the whole day. Not necessarily fatigue on exertion, but fatigue generalized. There may be issues with the person's sleep, as they say that they feel that they're not necessarily rested even after waking up, even though they mention that they typically sleep for long periods of time. And of course, again, looking at the family history and the possible genetic correlation. Other examinations, they do physical examination to look for if there is joint swelling, if there is tenderness, the range of motion, because since this is, again, a neuromuscular disorder, typically you do find the issues with the pain for the neurological aspect, but also from the myalgia or the muscle pain that they feel, you'll find in the difference, concentrated pain in joints as well as in areas where it is very responsible for gross movement, okay? So they look for range of motion and also for crepitus, which is the sounds produced in joints as it's flexing and moving. Okay. Also, they tend to rule out other comorbidities that have very similar presentation to fibromyalgia, such as depression or sleep apnea, which you find with the mood variations, or anxiety, which you also may find with the mood variations. IBS, that's irritable bowel syndrome, or SLE is systemic lupus erythematosus. OA is osteoarthritis or rheumatoid arthritis. These are other conditions that do have very similar sort of symptoms, and we've also looked at this. And so just to make sure to rule out that it's not that, and it is fibromyalgia, they do different tests as well. Now, even in Western medicine, they do accept the fact that it's not necessarily the case that if you have fibromyalgia, you can't have osteoarthritis or rheumatoid arthritis. It's very much possible that you can have both of these conditions at the same time as well. But they just want to make sure that it's definitely rheumatoid arthritis and fibromyalgia, or if it's just rheumatoid arthritis and not necessarily fibromyalgia. From our perspective, I'll explain in a second how we would look at it, okay? Other aspects of diagnosis, they do also serological tests where they look at ESR, which is the erythrocyte sedimentation rate. They also look at the complete blood cell count, thyroid function test, because even in issues with the thyroid can present with very similar sort of symptoms, especially when you find, when you look at hypothyroidism, tends to have quite similar symptoms as well. They look at for iron saturation and also for deficiency of vitamin B12 and vitamin D, okay? Also, nice little things to just keep in the back of your mind as we're going to look at it from the Ayurvedic perspective. Hint, hint. Okay. Also, another criteria that they do tend to look at for the for diagnosis of fibromyalgia is the tender point criteria. So in that, they look at these 18 different points on the body and basically stimulate these areas to see if the person does have pain or tenderness in these areas. And in order for it to be diagnosed as fibromyalgia, there has to be a minimum of 11 points of tenderness out of these 18 different points, okay? So it can be any one of these 11 points, but a minimum of 11 points needs to be somewhat tender in order for them to qualify with the diagnosis of fibromyalgia. Okay. I just want you to look at these as well. So for those of you who remember your murmas, I can't remember them offhand, the names of all of them, but these do correlate with a lot of the murma points that we have learned. These are definitely murma points. So just to remember that we're looking at, again, tenderness or sensitivity in these areas, okay? So the conventional treatment for if someone is diagnosed with fibromyalgia, again, depending on the presentation of their symptoms and the intensity of their symptoms, these are possible treatment aspects that their PCP may prescribe for them. So they may be prescribed analgesics, which are different types of painkillers. Examples of that is acetaminophen or ibuprofen, that's Advil or Motrin. Acetaminophen is, I think that's Aleve, and naproxen sodium. They may also be prescribed antidepressants for the mood issues. So duloxetine or milnacipran. They may also be prescribed anti-rheumatic agents such as tramadol, long-term antibiotic therapy, because if there's an indication that it may be due to some form of viral infection, then they may be put on long-term antibiotic therapy to help to fight off that infection. They may also be put under tranquilizers that's advised to take along with rest. So an example of that is gabapentin. Gabapentin is used for many different things, but it is can also be used as a tranquilizer as well. And a gentle exercise program, because that helps to increase the serotonin and endorphins, so that helps to kind of ward off or helps to balance off the sort of hormonal imbalance that you do find in the onset of fibromyalgia. Okay, so I just wanted to put this out here again to reiterate how we look at disease. So notice here, I have not put in the causative factors, the nidana, for what this condition may be, because ideally at this point, hopefully you all would have had an idea. So I'm gonna just stop this for a second, and I do want to open this up for a little bit of a discussion to ask you, what is the idea, or what is the perspective that you have now hopefully had an idea to create in your mind, just looking at it from what we've described from the conventional aspect? So please chime in. For those of you who are present, feel free to unmute and talk. Anyone? Okay, so basically what this is describing, or what this condition is indicating, it's definitely indicating an issue with Vata, because of the fact that it's definitely indicating an issue with Vata, because if we look at these symptoms, if we look at the symptoms here, we look at the causative factors that they've described. Remember, each one of these causative factors, as we had looked at earlier, these are all things that stop or hinder the flow movement of Vata. Physical trauma is a very ideal concept or an aspect of how you can actually immediately stop the flow of Vata, and therefore it immediately causes an aggravation of Vata. So does surgery, does the exact same thing. It causes a break in the flow of prana and the flow of Vyana Vata. So that also is a causative factor for aggravation of Vata. Infections is, typically we look at infections tend to be a basic factor or a reaction to when there's ama that is localized in a particular area. We can't tend to have infection without the presence of AMA. It's so almost sort of a basic criteria, or we can almost assume that in almost all forms of infection that AMA is definitely present. And significant psychological stress. There is that aggravation of Vata. And we have looked at the correlation between the mind and the rate and the flow and the rhythm of Vata. They both are parallel to each other. Okay, so whenever there is a change or there is an aggravation in the flow and the functioning of the mind, and when the mind function and flow itself has become irregular or erratic, that will also affect the flow and the functioning and the rhythm of Vata. And therefore, Vata also becomes even more erratic than it already is. Okay, it enhances that particular quality of Vata. If we look at this aspect, the reason I put this in here is because as I was writing this up, this thought came to my mind that if we're looking at it from the aspect of the brain and where we're perceiving this, even in that, because I remember my teacher saying this once, that the reason why we can't sleep when we have pain is because the pain center in the brain is very closely related to, or in close proximity to, the area that enhances or is responsible for induction of sleep. And the sleep is basically induced in the hypothalamus, which is just internal to this area right here. So for instance, if a person can't sleep, it does tend to, if this area here is hyperactivated, then it can definitely affect the area of the brain that is responsible for induction of sleep. If we want to look at it from this perspective, it completely falls in line in what we are looking at it from the Ayurvedic perspective as well. It's just we're describing it in slightly different terms, but the aspect of what's actually happening is very similar in the same way. Okay, so if we look at it, the area, the somatosensory cortex, or this particular area in the brain that is responsible for perception of pain and for processing of that information, it is also in close relationship to all of the other functions of Vata. So that's kind of why I wanted to put this in here, because what we're going to notice is in these particular conditions, it won't only be limited to just an issue with pain. You may definitely find an aggravation, or you may find variance in these other functionings of Vata as well. That's why, remember earlier when we talked about Vata Vyadis and we talked about Vata-related diseases, we look at it systemically. And we don't just look at just the one particular major symptoms. So for instance, if someone comes to you and says, I have fibromyalgia, I need your help, I would like you to help me manage this condition, what you're should instinctively think, or should instinctively do, is try to see how much more of Vata-related conditions they also have, or how it has developed into this particular stage of pathogenesis. Because most likely at the stage of fibromyalgia, it's definitely not the only thing that they have. It is an advanced stage of pathology, and it does take much longer in order for that to happen. So notice in most cases of fibromyalgia, that's not the only diagnosis that they have. They typically have at least one or two other pathologies or other diagnoses that goes along with it. That in itself just indicates how much of time and aggravation of doshas and stages of samprapti that the person has gone through in order to get this particular condition. So kind of, you can say that fibromyalgia is a secondary disease, or a secondary pathogenesis, or a secondary condition, vyadi, dependent on some of the other earlier vyadis, okay? almost you can say this is sort of at a Bheda state, where you have an original Vyadi and that has become uncontrolled, and then it has now started to produce another condition. It has started to produce divisions of that condition, and you end up with a upadrava, or a complication, or a secondary disorder. Okay? So that's the reason why I wanted to put this in here, is because I wanted you to see that the actual area or place in the brain that is responsible for the presentation of this particular disease is in very close relationship to some of the other functions of Vata that we do know of. So we may also start to look for, or just try to rule out from our aspect of ruling out other comorbidities of Vata, basically. We need to look for or ask for these particular types of questions to see if this is also affected. Now, in saying that, now, even though I showed you this picture, I'm not necessarily saying that Vata is only affecting here. What it's indicating is that Vata is affecting other aspects as well, and I'll explain that in a second too. Okay, so again, all of the factors here, one other thing that you should be picking up on is the fact that it's not just Vata symptoms that's showing up here. There's one other thing that's involved, and that's, ideally, if we look at it, this is also the involvement of Ama. Okay, now what we want to see is, and the reason why you find the involvement of Ama is because you do have the other issues as the depression and the anxiety and the lack of enthusiasm, the lack of ability to engage in different things, the fatigue. These are all actually typically brought on when there is an involvement of Ama. You don't find that when it is a purely Vata condition, okay? So you have the issues of Vata and Ama as well. So the reason why I've put this in here as generalized causative factors is because sometimes it is just generalized causative factors. And it may take a very long time to progress to this condition. So for instance, in the earlier slide where we looked at some of the causative factors such as physical injury or surgery or infections or psychological stress, these are direct factors that do aggravate Vata, and we know that, and they have an immediate impact on the flow and the aggravation of Vata. However, there was this other factor where sometimes it may be a gradual onset and it may not necessarily have a single triggering event. Okay, those are triggering events. Whereas in certain cases where it is a gradual progression, these are the factors that can cause the gradual progression. And these are all things that we do know about and that we are very much aware of. So what was described earlier was more in the factor or the realm of closer to Bahya causative factors. So physical injury happens from the external. Surgery also is something that is inflicted from the external. Infections can definitely be internal, that is affected by these factors here. And psychological stress is apart from the Bahya Abhyantara, but in the Manasa side and not in the Sharira aspect. This is looking at Sharira aspect, but you can also have the causative factors from the mind. And this goes all the way back again to the basics of what we looked at, whether it is a Sharirika dosha or a dosha of the body, that is Vata Pitta Kapha, that is affected, or whether it is a Manasika dosha, whether it is Rajas or Tamas that is affected. And in this particular condition, it is Tamas of the mind. Okay, so instead of terming it as Ama of the mind, it's actually more of Tamas of the mind. And Ama can induce that Tamasika quality. in the mind, because what the ama does is the ama slows down the movement of the mind. And as the mind moves slower, it tends to bring on or enhance more of the tamasika qualities in the mind. So hopefully that now makes sense. So a very easy way to look at it is say that there's ama in the mind. But what does that really mean? Because the mind, in order for ama to exist in the mind should have that physical ability, or the mind should have that agni to digest the ama to get rid of it, right? So you can't necessarily digest the ama in the mind, but the actual doshas of the mind is rajas and tamas. Those are the doshas of the mind. So when you have psychological imbalances, it typically falls under the realm of either rajas or tamas. Sattva or sattvika qualities do not produce any abnormalities in the mind. It is the pure nature or the innate nature of the mind. So that's ideally, if we want to look at the health of the mind or the balance of the mind, we need to enhance more of the sattvika qualities, okay? So in this particular instance where you do have the psychological factor, it's actually the tamasika qualities that are more predominant in the mind, okay? So in looking at this is again why I put this in here, is because it seems fairly generalized, and it seems that, again, why we would look at diet and lifestyle and season and the natural changes or the natural effect of the doshas is because, again, that is the basis for how this starts to build and how it starts to grow. Now, that is assuming that at baseline, the person was healthy and they didn't have any other pre-existing conditions. Now, if a person is born healthy and they're born with no other pre-existing conditions or pre-existing imbalances, then what they're starting off with is a healthy baseline. And due to these factors, you have the natural variations of the doshas, and you have the natural changes that occur. And if we are following a proper diet and lifestyle, we can work along with those variations and still maintain our health, because the regimens that have been prescribed is to help to maintain that balance even when it is rising and falling, okay? If we don't do that, then that helps it to build and build and build. And again, it builds, it causes the imbalance of doshas. So the doshas don't only go from a kshaya, chaya and prakopa stage, but they actually end up becoming more pathological, where they can then come into prasara, and they can then become more in the vikrita avastha. Okay? So once it gets into dosha vikriti, then we start to see impairment in these factors. So I know this is, again, a revision and a repetition, but I wanted you to look at it in the perspective of this particular condition. And in this timeline, you can apply this to any disease. But I wanted you to just get the practice of being able to see this or keep this in mind when you're looking at all different sort of diseases. So though this is kind of general, it can be generally applied to all things, but you can fill this in according to what you see happening. And also what you're going to notice is that the various different diseases that occur in the person are in conjunction with what you're seeing over here. Okay, so for instance, if a person comes to you and they say they have fibromyalgia, but they also have rheumatoid arthritis, and they also have high blood pressure, and they also have diabetes, and they also have all of these other conditions, what you're going to look at is you're going to start to be able to fill in these. And you're going to start to see, you're going to ask them about their typical intake, the typical diet and lifestyle. You're going to start to be able to identify what were the causative factors in their diet and lifestyle that has then contributed to this dosha vikriti, that has then contributed to the particular vyadhi avastha or the stage of disease and manifestation of disease, and how that has then progressed to either stay as one disease or become even more aggravated and start to spread even more and create more disease and more number of conditions. And that actually comes into this. So this is how we look at it. So in the perspective of getting even more deep and looking at the 6 stages of Samprapti, we can have one condition, one disease that occurs. It goes through, you have your causative factors, you have your dosha vikriti, and then you have your disease. That's one disease. But this can also be then broken down in here also as stages of disease according to stages of Samprapti, where you have a disease and the disease itself is in the mild condition, then it gets aggravated even more, then it starts to become so uncontrollable, then the disease starts to spread. So does that sound a little bit familiar as the same sort of 6 stages of Samprapti? So one disease can then become the causative factor for another disease. And that's how you end up with someone with multiple pathologies and multiple diseases. But ideally, it's again in the same process or the same storyline. You see the storyline of how it started here, then it progressed, then the causative factor or the pathogenesis then becomes one. It's not multiple things and they're not separate. It is one whole system, and how this aggravation or this change in the system is now progressing to become different things. And it's then manifesting as multiple things, okay? So first it would have started off as some issue. It can usually start off over here, or it can start here and move this way, or it can start here and move this way. Either way, you're gonna look at where it starts from, because according to what the pathology is for the person, you're going to look at. So for instance, if the person comes in and says, oh, well, you know, I've always had some sort of allergies, I've had some skin allergies, or I've had some seasonal allergies, and then after that, I have high blood pressure, and then after that, I was diagnosed with RA, and that's kind of under control now. And now the doctors recently diagnosed me with fibromyalgia, and so I have this as well. And it's not necessarily the RA, but I also have this generalized pain that it's not just in my joints, but it's everywhere, and I feel tired all the time, and I have no energy. So can you see, even in looking at this very short little list here, how it may be progressing? Even if you were to make a list of 7 dhatus, can you see then how it will start to progress? It starts to affect first the upper dhatus, then it starts to go down and move deeper and deeper and deeper and deeper. Okay? So I just wanted to put that out there, because most of the time when you have people who have multiple pathologies, it's the same disease condition manifesting in multiple roga margas or in multiple pathways. Okay? Okie dokie. So this is just to remind you in the Bahya Marga which disorders are there, such as pimples and molds and goiter and freckles and edema and abscess. And in the Madhyama Marga, here's where you get a lot of the musculoskeletal disorders. And in the Abhyantara Marga, here you have issues with that really affect or manifest in the GIT. Okay? So what this condition really is, or the closest relation that I've found, and I did quite a bit of research because I've seen online, there are a couple of instances where they say that it is Vata that has settled in the in the Mamsa Dhatu because it is fibromyalgia, because it's a muscular disorder. So it has been termed as Vata settling in the muscles. And if we look at it, fibromyalgia, it's very easy for us to say, yes, it is Vata in the muscular tissue, right? But there's something different here, because in the classical text, now why we need to always go back to the classical text is because it's so specific, and they have given us so much information that it really helps to dispel all of the guessing that we would do and sometimes confuse ourselves. Okay, so whenever something seems to be confusing, better to go back to the source of people who understood it even more than we did. So if we go back to the classical text and look at what has been described for each and every particular condition, or Vata being associated in each and every dhatu, what are the signs and symptoms that are being produced? The closest relationship that we find with what is described in fibromyalgia and is correlated or very similar to what is described in Vata that is being obstructed in the asti, with asti or majja dhatu. And I will explain that in a second. Okay, so here if we see the signs and symptoms that are basically, remember we talked about if Vata gets aggravated, there are two ways it can get aggravated. Either if it is moving too much, if there is depletion of the tissues and there is more amount of space, so Vata moves more faster, or if there is a block, if something is blocking the movement of Vata, that also can be the sort of the simplest form of pathology of aggravation of Vata. Okay, so this is a condition where there is something that's blocking Vata. That's what avarna or avrata means. Okay, so the Vata that is being blocked. And what is it being blocked by? It is being blocked by an abnormal or aggravation of asti and majja dhatu, which basically means that Vata is being blocked specifically in the asti vaha shrotas and in the majja vaha shrotas. Okay, another thing to keep in mind. Now you see how they're all starting to tie together. It's very hard to understand these systems or understand shrotas and the application of that until you actually get to these particular conditions, because what it's indicating is it's actually indicating systems in the body. Okay, so the signs and symptoms of Vata being blocked or aggravated, causing aggravation in the Astiva Shrotas and also in the Majjava Shrotas. In Astiva, you find the person tends to crave hot comforts, which is expected in the aggravation of Vata. And so they also crave compression or kneading type of massage. They feel like they want to have something that is being kneaded or twisted, or some amount of pressure where you're actually breaking up something. Because what that helps to do is when Vata gets blocked, the kneading actually helps to displace it. So sometimes in that kneading procedure, you can help to remove a bit of the block so Vata can move easier. Okay, the person also tends to feel a breaking sort of pain because it's Vata getting blocked, Vata moving through, and it's finding a way for it to get through that particular block in that channel. So it feels almost like something is breaking through or something that is splitting apart. They also feel depression, Siddhata. You find that in the Astiva Shrotas. Now, typically, I think we think Astiva Shrotas, we think only Asti. We think only about bones. But that again, Astiva Shrotas or Asti isn't necessarily only bones. Shrotas is a channel or a pathway. So that basically indicates that it is something apart from just the physical bones that we look at. So you see now, when we look more deeply and more specifically, the actual structures and that which we are segregating out those segregations start to somewhat disappear. They don't necessarily apply. So in the indication or talking about asti vahashrotas, it's not just bones alone. It's looking at all of the factors that play into or are responsible for the formation of bones, for the nourishment of bones, for bones to be able to carry out their functions. All of that is indicated or comes under the banner of asti vahashrotas. So in looking at that, it's not just bones. Bones is just one part of it, okay? So here we find that in this condition, you can cause depression because it's also it's blocking the flow of Vata, which again is in parallel with blocking the flow of the mind as well. So when there is a block in the flow of mind, when the mind slows down, it enhances more of the tamasika qualities in the mind. That's why you end up feeling more blue, more down, more heavy, not able to engage, not able to process information. All of these things are the tamasika qualities in the mind. Also, they have the feeling of being pricked with needles, which tends to happen when Vata is moving. It's isolated in one place and it moves around too fast and it starts to dry out. So it actually causes this pins and needles sensation. That is, again, another typical symptom of Vata being stuck in one place. Also, you find the signs and symptoms of Vata being stuck or Vata being blocked by in the Majjavashrotas or by Majjadhatu. So you find deformation, which the person, not necessarily constant deformation, like it's not to say that something has changed structurally and it stays that way. It could just mean the fact that the person is hunched over or they tend to be more hunched over than usual. Or you find that there's bending of the body, which means, like, you ever notice like certain people or people who have fibromyalgia, when they get up, they have to stretch and try to straighten out their body, because when they get up, they instinctively tend to bend forward a bit. It's because they don't have that elasticity, and that Vata is starting to dry out and stiffen. And if you remember that Vata plus stiffening tends to happen when there is Vata and Ama involved, okay? Also, you will find that the signs and symptoms for Majja is such as yawning. There will be a twisting pain, colic pain, and the patient gets relief if they're pressed with hands. So for instance, if there is generalized compression, they do tend to feel a lot of relief. Now, another reason why this is the closest in the signs and symptoms description, this is the closest to that of fibromyalgia, because what is Majjadhatu? Remember, Majjadhatu is this right here. This is Majjadhatu. So Vata getting blocked or aggravated in the Majjadhatu can also explain why, if we're looking at it from this perspective, this is also goes along with what is described in Ayurveda, okay? So though we don't have a specific name, like this is a disease as such, but we're looking at it as this particular condition, okay, of avarna or blocking of Vata in Asti and Majjadhatu. Also, we also find that this is very similar to signs and symptoms in Sama Vata, that is Vata with Ama. So in Sama Vata, the person has tandra or sloth or stupor. They feel heavy. They're not able to be active, fatigue. Staimitya is inactivity or disinterest in activity. They just don't feel like doing anything. Gaurava is heaviness. Snigdhata is unctuousness. Arochika is loss of appetite or taste. They just don't really feel like eating all that much, or even if they do, they don't really, they're not very satisfied with the taste because they don't necessarily taste it. And then that tends to happen when there's ama, and you all know that. Alasya is lassitude or laziness. Shita is cold, shofa swelling, and they crave katu and ruksha. And the reason why is because katu is one of the best tastes that help to digest ama. Katu and ruksha also helps to dry out the excessive snigdhata that is present in ama. So these are the things that they tend to want. This is what has been described in Western literature about fibromyalgia. And if you see, this again indicates the presence of ama. So even if we don't know this, and we just know this in itself indicates that there is definitely a presence of ama. So for instance, cramping in the lower abdomen typically does tend to happen in ama. Of course, you can rule out other situations where that may happen as well, but that does happen when there is presence of ama. Sleep, the person wakes up tired even though they slept for a very long time. Now that is a very typical sign of ama, because ama does tend to induce the person to sleep for a very long time. They want to sleep because they feel heavy, but it's not a natural, healthy type of sleep. They're being induced into a state of sleep because of excessive ama and because of excessive tamasika qualities. So you notice even if a person is depressed, they tend to sleep a lot. And you would think that that sleep would help them to feel more rested, but the sleep doesn't make them feel rested. Instead, they wake up and they're still tired, and they're still heavy, and they're still, they're not ready to be active. They're not ready to do anything. They're not interested in doing anything. These, again, are all typical signs of presence of ama. Cognitive difficulties, foggy brain, not necessarily ama, but the ama inducing the tamasika qualities in the mind. Foggy brain is nothing but this tamasika quality in the mind. Remember when we talked about the presence of Agni and how Agni also is responsible for cognition, and Agni is also responsible for understanding and utilization of information that happens when Agni is present. And it's basically the subtle essence or the tejas part of Agni that is responsible, or you can even say that is sadhaka pitta that is responsible for understanding or cognition or processing of information. But when there is ama, that reduces that Agni. So it's not really reducing, you would say, Agni in the mind, but it reduces the Jatra Agni that then can cause depression of all other forms of Agni. Okay, so that's why the presence of ama can cause the person to have this cognitive difficulty or the foggy brain. Okay, and of course depression. So not directly exactly ama, but definitely associated with ama. This is why a lot of people do tend to say that there's ama in the mind. It's a very close correlation because the ama can slow down the mind and induce qualities of tamas, but it's actually the tamasika qualities in the mind that is causing this presentation. Okay, so basically, this again, as very simply what we had discussed before, this is a variation of kind of like a amavata condition. It is not typically what is described as amavata, because amavata has another specific description, being in larger joints, and has other things that we had talked about earlier. But if we look at the presence of ama and vata in a different pathway, in the pathway of the asti and majja dhatu, then that's where it's very similar to fibromyalgia. So again, We know how these factors then help to progress the disease or to that work in favor of the patient and to regress the condition. Okay, so I always want to keep putting this back out here, even though you've seen it a lot of times, so that you'll keep remembering how this information is important. And also you'll keep remembering that we always need to keep these factors in mind and look at how that is playing into the current presentation of the condition. Okay. Okay, so the treatment here is exactly the same treatment as what I had described in the Vada notes, and I've just kind of put it in here as well. The only thing extra that I've put in, so as usual, you know, you want to do Lankana, or you want to do fasting that will help to digest the ama. And also Swedana, dry type of Swedana, because that helps to break up the ama as well as reduce some of the snigdhata quality. And once we are able to get rid of the ama, then we have just the vata sort of situation to deal with. And once the ama gets removed, then it's easier for us to then start addressing the vata, because at this point vata has then reached to the lower dhatus, as you can see. Vata has reached, or vata is aggravated at the lower dhatu shrotas. So which means it has already affected all of the other dhatus and the other shrotas as well. So that's why it's important for us to get rid of the ama, so that we can start to pacify vata or get vata out and start to rejuvenate back all of the dhatus, because at this point everything will be somewhat depleted. That's another reason why the person feels so fatigued, is because of the basic factor that all of the dhatus are being malnourished. They're not being nourished properly. They're not getting they're not having normal, healthy new formation, and that which is already existent isn't getting nourishment to carry out its functions. And on top of that, you have vata that is further depleting it. So you can see that also is a causative factor for why the person feels fatigue. And of course, if all of this is depleted, then ojas is also depleted. So it's basically a condition that affects the whole system and affects the functioning of every single individual system as well. Okay. And the only extra factor that I put in here is you can use arishta. So we haven't talked about arishtas too much. Arishtas are different types of alcoholic preparations in Ayurveda. And the reason why alcoholic preparations, they are not very strong alcohol. It's just a maximum of 12% alcohol in the arishta preparations. But the reason why arishta preparations are really good in this particular condition is because, first of all, it's an alcoholic quantity. That alcohol tends to produce more amount of heat. And another thing is, alcoholic preparations do not require breakdown in order to produce their effects. So for instance, if you were to take an arishtam, it immediately starts to act. It doesn't require the presence of the agni to then break it down for it to then be transformed and then absorbed and then produce its pharmaceutical or therapeutic effect. Arishtas on its own, because of being fermented, already has its own enzymes. It has enough of the agni quality in it that doesn't require your agni to break it down. That's why when you take in any type of alcohol, it gets absorbed immediately. And that's why they say it's better to have alcohol after you ate food, because that creates somewhat of a buffer as to how much gets absorbed. But for instance, if you were to consume any form of alcohol on an empty stomach, it gets absorbed immediately. It doesn't require that regular process of metabolism for it to be absorbed and then start spreading its effect on the whole body. Similarly, we use that same concept in delivering medicines in the form of a arishta. So here, arishtas are actually ideal because if there is ama, we want to try to get these medicines or these particular herbs or these particular activities to the lower dhatus, as well as all of the dhatus in between, without necessarily waiting first to digest ama. So this has the ability to digest ama as well as be absorbed and affect all of the other dhatus as well. It's much more fast acting, and it also can give you a very slight little bit of energy, which, you know, typically happens. That's why we all want to, you know, drink a glass of wine after the end of a really long day, because it gives you a little bit of energy and it helps to rejuvenate you. So that's why arishtas, and depending on what we use or what we make the arishta out of, it has other therapeutic properties as well. So for instance, in this case, just as Dashamula Kashaya or Dashamula itself, the 10 different roots, does have a specific activity. It does help to digest ama. Its main activity is not for digesting ama, but it does help to digest ama. As well as it specifically does work on vata, pacifying vata, on the bones and the bone marrow, or asti and majjadhatu. Okay, so that's why Dashamula is ideal for this condition, but in the particular form of arishta is even more effective. Okay, so that's why that's the only extra thing that I put in here. Okay, so since we have only a few minutes left, maybe I will save these cases for the next time, because it's a really good case, and I wanted, it kind of really helps to tie in everything that we talked about, and just looking at how, when we talk about this theoretically, but how does it present, or how do we see this in an actual person? And I have this case that actually says exactly the same thing as what we have seen in these particular points. Okay, so since we have a few minutes left, does anyone have any questions or anything that we would like to talk about before we end? And we'll save these cases, and maybe next time we'll have just a couple of case presentations. And if you have a case that you want to share with us and you would like to discuss, please feel free to send that into me, so that, you know, we, in the last module, we didn't get a chance to discuss as many of your cases, but if you do have any case that is related to musculoskeletal disorders, please send me the case, and then we can discuss it as a group. We can share the case and look at, you know, how we would want to approach this condition. Okay, so any questions?
Can I just chime in?
Yeah, absolutely.
So I just wanted to say that 12 or 15 years ago, I saw many clients coming in with fibromyalgia, mostly women, all women, for the most part. And in recent years, I see little to none. Mm-hmm. And it seemed like it was the designer thing like 12, 15 years ago. But I see very little of it today. And I know some of the cases I dealt with turned out to be undiagnosed Lyme in the area where I live. Mm-hmm. But just that I used to see it all the time, you know, from an outside, you know, Western diagnosis, and I very, very rarely see it anymore. So, mm-hmm. You know, interesting.
It's funny that a lot of these other conditions have very similar presentation. Now, the reason why I wanted to show you this from an Ayurvedic perspective is because we don't necessarily need the Western diagnosis to still look at it from this manner. So anyone who still has this presentation of having these particular signs and symptoms and is clearly indicating that they do have ama, and that ama is blocking vata, or it is mixed with vata, and we start to see, you can see the signs and symptoms in rasa dhatu or in rakta dhatu or in any one of the dhatus. In this particular condition, it's really exhibiting in the Asti and Majjadhatu. So if we find that this is happening, then that's kind of what we're going to look at, because we're going to be able to understand to what depth and how much of time it is taken for it to get to the stage. So it indicates kind of the chronicity. It also indicates what we then would need to do to help to control this condition. So ideally, whether it is diagnosed as fibromyalgia or if it's diagnosed as something else. Even in Lyme's disease can present in multiple different ways. And even in Lyme's disease presenting as this, we would still approach it in the same way. Okay.
Anusha, can
Yep.
you hear me?
Yeah, go ahead.
Okay, this is Sharon. I'm just wondering, in terms of the infection being a trigger, I was thinking, infection generally indicates some inflammation, and I'm wondering what aspect of is Pitta playing in all of this, or is this strictly all about Ama?
It is about Ama. And this is, again, another, sometimes it's a misconception that inflammation is due to Pitta, not necessarily the case. Inflammations, it tends to be a reflection of Ama that's displacing Agni. So remember when we talked about fevers, we just briefly talked about it. And this is, again, why fever is such an important chapter, but it seems so insignificant that it's hard to make fever a module. And fever, an important module that people will be like, oh yes, I want to come out and learn about fevers. but from the Ayurvedic perspective, it's a very important chapter. It's the first chapter because it basically describes every kind of presentation or aspect of pathology you can find. And what that indicates, what the basic pathogenesis for fever is, when there is Ama, there is, due to some variation of Agni, that Ama gets formed. When there is a presence of Ama has the ability to also displace the Agni. And when that Ama, in the particular presentation of fever, Ama actually pushes the Agni out of its place. So it occupies its space in the stomach. Ama is there, but the Agni is somewhere else. That's why you feel that hyperpyrexia or that increase in temperature. So there's no really issue with Pitta. There can be, but it's not necessarily the case. It's actually an issue with Ama and Agni. And in inflammations also, you can have all different types of inflammations. It's not necessarily an issue with Pitta. This is the same misconception of Pitta and Agni being the same thing, where we know very clearly that Pitta and Agni are not the same thing, right? So I'm glad you asked that question, because we're kind of doing a little bit of myth busting in the process of our different modules and looking more deeper into what exactly each and every one of these things mean. Because we do have the basic knowledge of it. But the problem is when you look at it on just the basic level and you're faced with the deeper questions, then that basic perspective isn't enough to answer those questions. So in this perspective, in this aspect, where you have an inflammation, typically that inflammation does tend to occur because of Ama. So Ama is what helps to cause that change and causes it to fester and to progress into other forms of inflammations and infections, and then can go to the point of separation where it starts to digest and forms pus and becomes something else. So in that process, typically, again, it's Ama and Agni and not necessarily Pitta. It can involve Pitta, and you have Pitta types of inflammations, but you also have Vata types of inflammations. You also have Kapha types of inflammations. So it's not necessarily all inflammations are of a Pitta involvement. It's actually more of Ama and Agni, an issue with Ama and Agni.
Okay, so an infection of a a pathogen or a krimi, an outside agent, is disrupting the Agni, and because that agent is disrupting the Agni, that then Ama is produced?
Yes, yes.
Thank you.
That because if you notice, almost all medicines that we use for fighting krimis do come in from the outside, and we completely accept that. But what happens once the krimi comes inside? It then, the same thing, it starts to affect the Agni, and it starts to produce a sort of like a krimija ama, or a krimi-based ama. And even in the treatment of krimi also, all of those things actually increase the Agni. You notice every single thing that has been advised or described for that is krimigna, or that kills krimis, it's all actually the same thing of increasing Agni. Its basic principle or activity is that it increases Agni, and by increasing the Agni, it kills the krimi.
Gotcha.
So even in those particular types of infections as well, again, it's the Agni. So what Charaka says, that Agni, if you can increase the Agni or maintain the Agni, that is half of your treatment right there. Now you can see why. Why increasing the Agni is so crucial and so important in the success of your intervention. And that's why we always, all the older Vedyas, they always start at this first. They always start. One of the older Vedyas from Mysore, that's what he did. No matter what the condition is, it doesn't matter what you have. The first and foremost thing he used to give is 3 days of Ajamoda powder 3 times a day. That's what you start with. So whether you have signs of ama or you don't have signs of ama, even in cases of hyperacidity or peptic ulcers, even then he would advise the use of Ajamoda or Ajwain powder for 3 days, and then after that he would start his treatment. So I heard about this and I wasn't completely sure, but I was like, well, he's an experienced Vaidya, so I'm going to follow his same style. So I did the exact same thing in my first case of hyperacidity. First ever case I got of a peptic ulcer. And the peptic ulcer was in an 18-year-old. And I was really scared that I wasn't sure if this would work or if it would be a problem. But I was like, well, this person is very experienced and clearly they have an idea or they know what they're talking about, so I'm going to do it. So I advised her to the same thing. I advised her to take the Ajamoda Churna for 3 days, 3 times a day before each meal. And then after that, started the typical intervention for peptic ulcers, which is a calcium-based powder. Basically, it's a pravala bhasma or the incineration of coral ash. So that's a high calcium base. Or even we can use guduchi as well. Same composition, same concept. So I used pravala bhasma for her, and that's what she took. And I was surprised that, I was expecting that she might say the Ajamoda Churna enhanced the effect and it was too much and there was more burning sensation, but she said no, it was fine. She didn't really feel the effects of that at all. But that's because, again, even in that situation where it's presenting as burning, it's burning because there is a presence of ama, and ama has displaced the Agni. So you're feeling the Agni somewhere else and it's not where it's supposed to be. I know. So it seems complicated and simple at the same time.
It does. Thank you.
You're welcome. Okay, due to block Vata or too much space or Vata to move. This condition is due to blocked Vata, not due to Vata having too much space. That's why it is Avrita Vata. And what do Western medications do? Block Vata more. To some extent. So for instance, the pain relievers will temporarily help to pacify that overstimulation of the nerves. The antibiotics kind of actually can help a little bit with the condition, in the sense that when you're taking it, antibiotics do have the ability to somewhat create a pseudo Agni in a sense. It's like an artificial Agni or a pseudo Agni. But the minute you stop taking it, it hasn't actually increased your own Agni. It acts in the place of your Agni. So that's why when you take the antibiotics, it helps to fight off things, and you're all of a sudden you're more hungry, and you require more amount of food in order to buffer or pacify some of the extreme heat that is produced from the antibiotics, but it in no way affects or enhances your Agni. So once you stop taking the antibiotics, it is actually further reduced or killed your Agni, and then you have to start over and build back your Agni again. So that pseudo Agni of the antibiotics does help temporarily. It does help partially in not really digesting ama, but just reducing the effects of ama. But once you stop it, the ama is still there. It hasn't really been digested. And you haven't increased your Agni to help to digest the ama. So therefore, it'll still be there after that as well. And you may not necessarily, sometimes you feel the pain, sometimes you don't feel the pain, but it will definitely come back until and unless you don't actually increase your Agni. Okay? And digest the ama. Okay. So are there any other questions? Good questions, by the way. Thank you. Okay. Well, if there aren't any other questions, then we'll end it here for tonight. And I will save these cases. I have one that is somewhat of a straightforward case. It's complicated but straightforward. And then I have another one that is very complicated and a little bit of a trick patient for you, but I still wanted to share it with you because sometimes we get cases like that too. Okay, and again, if you have any cases either right now or from the past that you would like to discuss that is relevant to this topic or to any one of the musculoskeletal disorders, feel free to share it with me and we'll go through it in one of the webinars. Okay, okie dokie. Hope you all have a very good night and a wonderful weekend. And please go out and vote.
Yeah.
I shouldn't have any political things out there, but that's just a basic right.
Yeah. There you go. Thanks, Anusha.
Thank you.
Thank you. Good night, everyone.
Good night.
Okay. Good night. Bye, everybody.